Heart Health Awareness Month may be winding down, but that is no excuse to stop practicing healthy habits.
Our 9 health expert, Dr. Payal Kohli, joins our team this morning to talk a little bit more about this. Dr. Kohli, we've been teasing about this all morning long. What are some of the lifestyle choices that you would never make yourself as a cardiologist?
There are a few, actually. So the first is never to smoke. And I'm talking not just about tobacco, but also marijuana. Many of us think it's safe to do that, but what it actually does, especially for women, is made the inside of the arteries really sticky. So it can substantially increase our risk of course, heart disease, but also stroke. So that's something we ought to be mindful of. If you want to use marijuana, a safer way to use it is to use those edibles instead.
Okay.
The second, and this is one I'm not good at doing myself because of my job, you have to sleep 7 to 9 hours a night.
That's rough,
yeah. So don't cut down on that sleep, especially the morning anchors sitting in front of me, because it builds inflammation inside the body. And all you're doing is just sort of depleting your savings bank, your antioxidant savings bank. And so if you can't sleep during the week, then you got to catch up on the weekend, or you got to have days where you do get that sleep, but 7 to 9 hours on average.
When we say catch up, or we're talking about this sleep, asking for a friend, are we saying consecutively you need to sleep that 7 to 9 hours, or is there a way, like, maybe you're a parent and your kids kept you up, or you're a morning anchor and your alarm goes off a little early and you get 5 hours. Can you take a 2-hour nap to make up the difference? Absolutely.
Okay. And so sometimes the naps can mess up our circadian rhythm, so you have to make sure you time the naps correctly. Sure. But that is exactly right. So I'm talking 7 to 9 hours on average in a 24-hour period. So if you're taking a little nap or a cat nap or something, then that's the right way to do it. And then the last one, which is also difficult sometimes when we like to go out on weekends or we have parties and such.
I knew this one was coming.
No binge drinking. and binge drinking is defined by the CDC as 4 drinks or more for women and 5 or more for men. So sometimes people say, oh, well, I only drink on the weekends, Dr. Kohli. That's actually worse for your body because the cumulative dose of alcohol you're getting in any given setting is much higher. So I'd rather you have 1 drink 5 days a week rather than drinking 5 drinks on a Saturday.
Okay, good to know.
Exactly. See, she's saying you can still have drinks, y'all. I'm not saying cut them out, just, like everything in moderation.
That's right.
What are some warning signs that you would never ignore?
Okay, so a big one that patients often miss and their partners often miss is snoring. So if somebody is snoring, your partner snores, that could be obstructive sleep apnea. And here in Colorado, we actually have a, potentially higher risk of sleep apnea because we're at higher altitude. And what sleep apnea means is that oxygen's not getting in at night, creating inflammation and stress hormones all night long, which are then implementing in cardiovascular changes and cardiovascular risk. So don't just, elbow them when they're snoring. Tell them to talk to their doctor about that, particularly if they kind of startle themselves awake snoring or they stop breathing.
I will say, so my partner has to wake me up because I do snore. And I've started using those nasal strips. And then I also, shove some Vicks up there too to help breathe it. And I will tell you, my sleep is so different. Right. I wake up in the morning almost loopy because I don't think my brain is used to taking that much oxygen.
That's exactly right. And probably your blood pressure is better.
Yeah,
too,
absolutely.
So that other sign that's called a silent killer, guys, is the blood pressure. That can sneak up on us, and people often think blood pressure 120/80 is normal. That's actually considered elevated or pre-hypertension. So what we're really shooting for is 110s/60s to 70s. And if it starts to creep up more than that, don't ignore it. Don't say, oh, it's only high when I'm at the doctor's. That's called white coat hypertension. That also predicts cardiovascular risk.
What are some other tests, real quick, that you would not miss?
So a calcium score, if you're over the age of 40, it's a quick x-ray of the heart that tells you if you already have plaque. The regular blood tests, of course, your cholesterol, your sugar control, but also a special one called lipoprotein A, which now the AHA is recommending every single one of us check. 20% of us have it elevated, and it's a genetic marker of risk that we want to identify early in our life.
Okay, look, quit looking at me.
I looked at you when we were on video because I wasn't going to call you out on screen, but you called yourself out.
Yeah, I just had all these tests done. We're looking good.
So proud of you.
Just gotta say.
Oh, me too. Like proud moms over here.
Dr. Kohli, we appreciate you. Thank you.